Whether you're a seasoned driver or a frontline healthcare provider, decompression sickness or DCS is something you need to understand. In this video, we'll take a deep dive into the science behind DCS, how it presents, how to manage it in the field, and how to use tools like divemedic.net to make informed real-time decisions. Decompression sickness, also known as the bends, is a condition caused by nitrogen or other inert gases forming bubbles in tissues and blood during or after a reduction in pressure, most commonly during ascent after diving. When under pressure, inert gases dissolve in body tissues. If the ascent is too rapid or decompression stops or skipped, these gases come out of solution as bubbles. The effects can be localized or systemic. DCS is influenced by dive depth, duration, ascent rate, gas mix, temperature, hydration, fatigue, and individual susceptibility. Bubbles can obstruct vessels, trigger inflammatory cascades, damage endothelium, and disrupt neural transmission. This is why symptoms vary widely from mild to life-threatening. Symptoms of DCS typically develop within 15 minutes to 12 hours after surfacing, though delayed cases can occur up to 24 hours later. Symptoms fall into two broad categories: Type 1 DCS, musculoskeletal or cutaneous, joint pain, especially shoulders, elbows, knees; skin itching or mottling, cutis marmorata, lymphatic swelling; Type 2 DCS, neurological or cardiopulmonary, numbness, weakness, tingling, ataxia, dizziness, speech difficulties, bladder dysfunction, chest pain, cough, or shortness of breath. Always assume symptoms could progress. Early management improves outcomes. Here's your DCS first aid protocol. Administer 100% oxygen, preferably via non-rebreather mask. Lay the patient flat, unless airway concerns dictate otherwise. Remove from water. Keep warm and still. Hydrate orally if alert and not vomiting. Avoid altitude. No air transport without pressure control. Arrange for hyperbaric consultation ASAP. Transport to a recompression facility is the definitive treatment. Not every diver with vague symptoms requires a chamber, but the lane treatment in true DCS is dangerous. That's where divemedic.net comes in. Built on criteria like the SANDHO rule, it helps stratify DCS risk quickly and safely. Especially useful for telemedicine consultations, dive boats, and rural hospitals. Let's walk through divemedic.net. It's browser-based, mobile-friendly, and free. Simply input symptom timing, dive profile, and presentation. The tool offers a risk tier and clinical guidance based on available evidence. Whether you're in the ER or 30 meters underwater, recognizing and responding to DCS quickly can mean the difference between full recovery and long-term harm. If this video helped you, please like, subscribe, and share it with your team. And remember, divemedic.net is your pocket DCS expert. Fast, evidence-based, and always free.